Live from Eyewitness News, this is breaking news.
Good afternoon, I'm Kate Walsh. Governor Gina Raimondo is giving us her daily update on Rhode Island's coronavirus containment efforts. We'll go live to the State House now, where she's just begun talking.
In the order that they are received. Today, I'm reporting that we have 17 new cases of coronavirus here in the state of Rhode Island, bringing us to a total of 83 cases. Some of you may be saying that 17 is a bigger jump than we usually have. That is true. We are not surprised by it, and we are not alarmed by it. In fact, you know, as a general rule, I would say we're not panicking. This isn't a time to panic. It's a time to plan and work and not panic. Plan for the worst, work for the best. 17 new cases, total of 83. No fatalities at this point. Yesterday, one of the questions that we received, actually a number of questions that we received that I didn't have a chance to address, relates to K through 12 distance learning plans. So to all the kids out there, school's back on tomorrow. Special note to teenagers: set your alarm, plan on getting out of bed. It's school. This is school. This isn't a day off. It's not a vacation. It's school. School in a different way. We're trying something new. Distance learning. How's it going to work? The answer is it's going to work a little differently in every single city or town. In some cities or towns, it will be mainly online. In other cities or towns, it might not be primarily online. Teachers may assign assignments and then figure out a way for students to do written work and drop it off someplace. In most places, it'll be a combination. It'll be a combination of online work, interacting with teachers and students over FaceTime or other form of video, a lot of phone calling between teachers and students, some experiential learning, and then, as I say, a lot of assignments where students can do writing and drop them off at an appropriate place. We're learning together on this one. As I said last week, what most states have done is just shut down school. I don't want to do that. I think our kids deserve a chance to learn, and I want to keep our teachers active and in touch with the students that they educate. We're getting lots and lots of questions, so here's my best advice. These next 10 days, these 2 weeks, they're a trial period. We're going to be better at this next week than we are this week. Be patient with the kinks and stay in very close contact with your teachers and school leaders. Teachers and principals will be providing information to you to answer your questions. If you don't have access to Wi-Fi in your house, if you don't have high-speed internet easily accessible, if you don't have a computer, get in touch with your teacher, get in touch with your principal, and they're going to work through to make arrangements for you. And I want to ask everybody's patience. I think we can do this. I know we can do this. And it's actually going to get us ready for the future. So let's embrace it, and let's thank our teachers. I do want to say one thing. Teachers have worked so hard last week to get ready for tomorrow. So thank you for doing it. We're proud of you. I appreciate it. And we're ready to go. Let's give this a try. Okay. I need everybody to listen to this. I don't want to drive around Rhode Island and see any groups of people larger than 10 people in close proximity. And I mean nobody. I don't want to see it in the parks. I don't want to see it on the streets. I don't want to see it at open houses. I don't want to see it at parties or dinner parties, in the mall, sneaking into hospitals to visit your loved ones, sneaking into nursing homes. Knock it off. This is serious business. And if we keep seeing what we're seeing, then we're going to have to move to a statewide lockdown, which, by the way, is something I'd like to avoid because there's already a lot of people out of work. You know, there are so many people right now, doctors, nurses, National Guard men and women, the Rhode Island Department of Health heroes, people, you know, working throughout state government, police officers, mayors, who are killing themselves to make sure that Rhode Islanders are safe and that we can get through this together. So in order for that to happen, every single Rhode Islander needs to be very serious in following these directions for the next few weeks, for the next 2 weeks. What we do in these next 2 weeks will determine our collective future. And I am very serious about that. We don't want to become New York City. We don't want to become Seattle, Washington. And the only way that we can prevent that is if we get more serious about this social distancing. I've been in touch 3 times today with Colonel Manny. State police are out and about. Local police officers are out and about. This isn't a joke. It's really not a joke. People will die. Our loved ones will die if we don't get a little bit more serious as Rhode Islanders heeding these directions. I've been on the phone with folks whose family members are pretty sick due to coronavirus, and they are begging me to beg you to follow the rules. So I'm asking you, please, follow the guidance and stay away from groups of 10 or more. And if you're in a group, you know, if you want to go out for a walk, that's terrific. If you want to go to the playground, great. If you want to go for a bike ride, great. Don't congregate. Keep yourself apart. Also, I want to say thank you to the Rhode Island Realtors Association. It came to our attention yesterday that there were a number of open houses, and we called the Realtors Association. They immediately did the right thing, sent word out to realtors to stop all open houses until further notice. I've been hearing from lots of friends who are telling me that they are personally calling off dinner parties and house parties. So I just want to say thank you. You're doing the right thing. If every citizen kind of helps us police this on an individual basis in your house, in your family, in your neighborhood, in your place of work, we're going to get it done. And we're going to get through this, and we're going to minimize the harm and sickness to Rhode Islanders. So, because we are unfortunately seeing that folks are not really heeding all of the directions, I am right now going to announce further business restrictions which go into effect at 5 o'clock tomorrow and stay into effect until further notice. Specifically, in a few minutes, I will be signing an executive order directing all recreation and entertainment facilities to close their in-person operations. So who does this affect? Theaters, cinemas, spas, barbershops, nail salons, beauty salons, tattoo shops, all kinds of, as I said, recreational or entertainment. By 5 o'clock tomorrow, you are directed to be closed to the public for business. Why until 5 o'clock tomorrow? Why does it begin 5 o'clock tomorrow? Tomorrow should not be a regular day of business. We've heard from many of you that you need a chance to get ready, to get back into your barbershop, to get back into your beauty salon, to get organized. I have sympathy for that. I understand that. You shouldn't really be open tomorrow, but we're giving you until 5 o'clock tomorrow to get organized and get prepared. As of 5 o'clock tomorrow, if you're a barbershop, nail salon, beauty salon, cinema, theater, and you're still open, you're breaking the law, and we will enforce it, and we will shut you down. Now, I want to say that's tough. That is a very tough decision for me to make, because having come out of the business world, having run a business myself, I have huge sympathy for the small businesses of Rhode Island right now. and I'm talking to them every day. And this is a tough one, which I had hoped to avoid and have avoided until today. So, and by the way, it is my intention to, I have my eye on getting our economy open as soon as is possible. So this isn't forever. This is extreme measures so we can drive our infection rate essentially to zero so that we can then think about reopening. Having said that, in the meantime, this is going to be very difficult. I want to remind you, you can file for unemployment insurance. I also want to say I've been working constantly with our federal delegation, Senators Reid and Whitehouse, Congressman Langevin and Cicilline, and they are working 24/7 to make sure we get the federal government stimulus that we need, including a replenishment of our unemployment insurance fund. So anyone could go file for unemployment insurance. We're paying the claims. You can call 521-HELP, which is a hotline that we've established, especially for businesses and small businesses. We have set up an emergency line of credit of up to $2 million through the federal SBA, and we are working hard with banks and the Fed and the federal government to do everything we can to get more financial relief to small businesses. So 521-HELP, if you're any small business who's getting crushed right now due to the restrictions of coronavirus. I want to make the following guideline. Tomorrow is the beginning of the work week, so I want to take a second to roll through the existing regulations as well as one more directive. For businesses that continue to remain open, and I know there are many, I want to remind you of the rules. You must have a work environment where your employees can maintain a distance of 6 feet apart. I've actually heard from many manufacturers who are still open, but they've changed the way they do business. People are 20 feet apart. They've changed their shifts. So if you can make these accommodations and absolutely shut down cafeterias, shut down coffee rooms, shut down anything where people congregate, you have to make it so that your employees can be 6 feet apart. Require employees to practice appropriate hygiene, constant hand washing, Purell or other kind of hand sanitizer available and used. Greet your employees at the door to make sure they are not sick. I'm very serious about that. Have somebody at the door checking to make sure, making visual contact with your employees just to make sure they're feeling okay. Anyone who's not feeling well, certainly anyone who's got a runny nose or a fever or bad headache, send them home. And regularly clean and disinfect frequently any surfaces that are frequently touched. If you follow those rules, we're going to be able to let you stay open. We are going to begin to conduct spot checking. We're going to be popping in on manufacturers, popping in on businesses, just to make sure that folks are following the rules. Somebody reached out to me this morning. They run a business that provides essential services to utilities. They say they only have 5 employees. Everybody else is working from home. I said, fine, stay open, keep your 5 employees there, keep everyone else working from home, check every single employee in the morning to make sure they're not sick, and keep these folks several feet apart. In the executive order that I'm about to sign, I'm also directing any business service personnel who can work from home to work from home. I'm talking about accountants, lawyers, human resources professionals. Most of you guys can work from home. I know it is inconvenient, but we're asking you to, we're directing you, ordering you to work from home. If you have your own business, or if you work within a larger business, these are the same rules. As I said earlier, if large professional services firms, financial services, accountants, HR professionals, lawyers, if you need to keep some very limited number of people in the office in order to keep things going, access files, etc., that's fine. but the professionals ought to be working from home. I continue to hear from way too many Rhode Islanders who are working at some of these professional services firms that their bosses are essentially, making them go to work in the office. That's not okay. The most limited number of people possible in the office, everybody else working from home. And by the way, if you need a hand, if you're a small firm, we have, Microsoft has made a donation to any small business in Rhode Island if you need help with video conference or remote working or remote file sharing. If you've never done it before, call 521-HELP, call the governor's office, and we'll get you set up with the software that can enable you to do effective remote working. I just want to reiterate, these aren't requests. These are directives. We're doing everything we can to keep you safe. With only 83 cases, Rhode Island is in relatively better shape right now. As I say every day, we're still a half step ahead of this virus. But if we don't all get a little bit more serious, I don't know if we can keep us there. I think we can. In fact, I know we can if we all do what we need to do. But I need everyone to get a little more focused on these directions, understand that they're not suggestions, and know that we're going to start to get a lot more serious about enforcement. A few other announcements. I'm announcing today that the U.S. Army Corps of Engineers will be deployed starting tomorrow to Rhode Island. And they're starting with a small group. They're going to expand. They are helping us primarily to ready buildings to provide surge capacity for our hospitals. We are preparing for a situation where our hospitals become overfilled. Could happen very quickly. And so we want to get ready. I should assure Rhode Islanders that this planning has been happening for weeks. So we're not starting tomorrow with the Army Corps. They're just giving us more manpower to literally go out and help us do the engineering work, architectural work, and other work to set up these buildings. Again, I want to be clear. Are we going to get to a place where our hospitals are overrun? That is very likely. You're seeing that all over the country. When will that happen? It depends how much social distancing we do, starting right now. The more we do, the longer it'll take, and maybe we'll never get there. But the mantra we have is, don't panic, get prepared, and assume the worst. So we've been planning for weeks to have surge capacity for hospital beds, surge capacity for quarantines, and surge capacity for healthcare employees, healthcare workers. It's not just having the beds and the ventilators and the equipment. We also need the doctors and nurses and CNAs and therapists to staff this. So I just want Rhode Islanders to know, I know a lot of people are reading about what's happening in California, what's happening in New Orleans, what's happening in New York City. We're not there. When you read those things, I would ask you to shut off your computer, take a deep breath, and just realize you're in Rhode Island, and we're not in New York City. We're here right now. At this moment, we've done a great job getting ahead of it. We have excellent plans in place for if and when the surge comes. And at this moment, no problem with a shortage of hospital beds or healthcare workers. Having said that, this thing changes by the day. And so I just want you to know we're on it, we're prepared. This is 24/7. We have many, many people working, and we have a good plan. We're executing the plan, and we're doing the very best that we can to make sure Rhode Island is ready, regardless of the eventuality. I want to make the same comment about supplies. There's a lot of chatter all over the internet, all over Rhode Island, all over the world about supplies. 2 weeks ago, most people didn't know what PPE was. Now we're all talking about it. Everybody knows what an N95 mask is. Everybody knows what a ventilator is. Everybody knows what PPE is. Here's what I want you to know. We are literally scouring the world. That is not an exaggeration. I am literally scouring the world, manufacturer by manufacturer, lab by lab, talking to FEMA, talking directly to chief executives of diagnostic companies, working with the National Guard. We've now deployed 1,000 National Guard men and women to make sure that we got you on this. It is not easy. It is a fight. It is a global fight, but we're doing fine. We have set up teams of people to work the supply chain. I have a team working on just masks, a team working on just hospital beds, a team working on just ventilators, and on and on and on. We're working. This is not an emergency situation right now. I do not want you to worry right now. And we're on it. We have a plan. We're working aggressively. We're working around the clock. And we, rest assured, a lot of you are reaching out to me. Yes, we know. We're in touch with people all over the world, literally, trying to get the supplies we need. A special note to our local manufacturers. You've been awesome. Truly fantastic. If any of you, I think we've heard from all of the textile manufacturers in Rhode Island who could be helpful, and I want to thank each and every one of you. We're already in the process of retooling many manufacturers, like say textile companies, so they can retool to make masks and gowns, etc. But if you're out there and you're a manufacturer in Rhode Island who hasn't reached out, please pick up the phone today, call Commerce, call the governor's office, call Department of Health, actually visit the website that the Department of Health has set up to get supplies, because we want to hear from you. If we can set up our own supply locally, of course, that would be better, and also keeps people to work. I'm trying desperately to make sure we keep as many jobs as we can, so if I can retrofit a current textile operation here and keep people working, it accomplishes two goals. Last note that I will say before I take questions is just a very, very big thank you to everybody in the faith community. I know this is like, it's unnatural. None of us wants to be here. Friday night, people, lives revolve around worshiping in a mosque. Sunday morning, families revolve around going to church together. You're all being fantastic. I know a lot of folks are worshiping online. A lot of folks are worshiping virtually over the phone. Thank you. You're all heroes, and it's really difficult, and I want to say thank you for doing your part. And that goes for everybody. There are some folks that aren't following the rules, and they're the ones who are putting all of us in danger. But there's a lot of people who are opening their hearts, who are following the rules, and who are kind of expressing kindness in millions of different ways. And I want to thank each and every one of you and beg you to keep it up. If every one of us does it, we'll get through it. Yesterday I was out for a walk and somebody drove by and said that they were on their way to deliver food to an elderly neighbor. So ask yourself right now, what can I do in this crisis? How can I serve? For most of you, the answer is stay at home. For some of you, there are different categories, and we're going to get through this. We're in a very, very good spot. We have a good plan, but now's the time to just take a breath, let the system work, and play the role that we're asking you to play. So with that, I'll ask Margie to come take us through the questions.
Good afternoon, Governor.
Good afternoon.
The first question is about the kids. They're wondering if the grab-and-go lunches and breakfasts will still be available next week.
Yes, the grab-and-go lunches and breakfast will still be available next week. Again, that is all being handled by cities and towns. Each city and town is doing it a little bit differently. And by the way, the same goes for seniors. Most cities and towns have at this point shut down, all of them have shut down their senior centers. However, they're each making provision to deliver meals or have grab-and-go sites for seniors. So all of that is happening. At this point, I'd like to say a major thank you to mayors. They are truly on the front lines, mayors and town managers. I've talked to all of them. Thank you guys, you're doing a terrific job. And if any people have questions about school, food for kids, and food for seniors, call your town hall, call your mayor, call the local senior center, and you can have that information.
So you mentioned that companies are repurposing to make face masks, but should people at home be trying to make these both for themselves and to donate to healthcare workers?
Yeah, so I'm smiling because that is a beautiful gesture. I'm going to say something, and then I'm going to turn it over to Dr. McDonald of the Department of Health. As has been said, if you're sick, you need to stay at home. If you're a healthcare worker, you need to have the appropriate medical equipment. So although that's a beautiful gesture, it's probably better to let us handle the distribution of properly made medical equipment and make sure and let us distribute it to the healthcare workers that are on the front lines.
So thank you, Governor. I just want to echo that. You know, what we're really focusing on is getting the proper equipment to the healthcare providers, and because we've been able to access the strategic national stockpile, a lot of that has occurred and is going to continue to occur. And keep in mind, healthcare providers need certain types of masks. You know, if you actually have those masks at home, it's probably better for you to donate them so we can distribute them to healthcare providers. But right now we're having some success distributing the N95 respirators, the gowns, and the gloves. We're looking at strategies to optimize the use of personal protective equipment. What we're really trying to do is make sure that the healthcare providers have what they need and use it very efficiently. Thank you.
Our next question is about business loans. There have been reports that there's been denials for SBA loans, even at the credit card rates. And what can the state do about this? Would you be willing to create your own sort of loan program?
Yeah. The answer is we're working on that. I'm also working daily and aggressively with the federal government and the Fed and our congressional delegation for them to provide a loan pool. But I want to ask Commerce Secretary Pryor to address the question.
Thank you, Governor. Stephen Pryor, Secretary of Commerce for the Governor. If you are having a problem with the SBA loan process, that problem could involve being declined for that loan, as the questioner was referencing. It could involve that we've been told that on a national basis, sometimes the system is crashing when you're entering your information. There's just so much demand upon the system. Please let us know at Commerce. That's the same number the governor's been mentioning, 521-HELP, of course, 401-521-HELP. Reach out to us and tell us if you're having a problem, either that decline or if the system's not working for you. What we're doing is interfacing. We have a terrific district director in Mark Hayward for the SBA. We're in touch with him and through him to the federal government around the problems with the program if we perceive that the rules are not being followed as to declines, or if there are technical problems, we're going to work to remedy them. We will have more to say in the coming days about possibilities for yet additional measures, as the governor referenced.
Governor, the next question is, can the Department of Health relax regulations to take advantage of all Rhode Island health professionals who have the experience, but perhaps they have an immigrant status, and also perhaps they don't speak English?
Yeah, so thank you for the question, Tony. I got to give a shout out to my friends at Poder. So we actually have enacted a really streamlined process for emergency licenses. Tomorrow morning, we're going to be issuing 41 licenses to very healthcare professionals for our emergency license provision, and I think that's very helpful. We've also put up some guidance about how you can do cross-medicine across different states, and we'll look at that specific provision you have about the language issue. So I think it's a great question. We're making some progress in that space. We obviously need healthcare workers. We have enough right now, but we're ensuring a future where we have plenty. Thank you.
And another question about our supplies. The reporter asks, we have a stockpile of PPEs. How many days will our current stockpile last based on current projections? And also, who's deciding how many go out each day and where they go?
So at this point, we have moved beyond just relying on the state's national stockpile. Last week, President Trump was very clear that the federal government isn't a shipping clerk, and the states were on our own to access the private market in order to procure these supplies. So that's what we're doing. Right now, we are in good shape. The Department of Health is in touch constantly with hospitals, and it's an ongoing discussion around who needs what. Hospitals are also working their supply chains. And we're thinking of it less in terms of the stockpile and more in terms of setting up a constant supply so that we always have more than enough. Furthermore, we're planning for a surge. So right now there is no issue, but we're planning for a major surge, and we want to make sure that we have the supplies. And so they're coming in on a daily basis. We're ordering direct. We're in touch with FEMA. They're sending us some, and it's a web of suppliers all feeding into our operations center managed by the National Guard, and then the Department of Health makes decisions around who to distribute it to, when, and how.
Massachusetts has identified when a healthcare professional gets corona and also where they worked. Can you confirm if there's any healthcare professionals in Rhode Island that have been diagnosed and what hospital they may have worked at?
So thank you. So our healthcare workers who have been diagnosed with COVID-19, our process when we find a healthcare worker is we notify them, then we do contact tracing. So we find out all the folks who are involved. And then we particularly make sure that patients are notified as well. So we haven't really confirmed. We're not telling folks which hospitals are involved. We're asking the hospitals to make those announcements to their patients, which we know they're doing. So since we're keeping track of the hospitals, we feel very confident that that's occurring.
Governor, I know you made some changes to the open meeting laws. Could you just review those changes and what your executive order says?
Yes, I will do that, and then I'm going to ask my Director of Administration to say a few words. Last week, I signed an executive order temporarily suspending the requirement in the open meetings law that requires public boards to meet in person in public. I did that to allow for conference calls and video conferences because I feel we need to keep government working. These boards and commissions, if they have essential meetings, need to continue to meet, but they ought to be able to do it with a phone call or a video conference. And so I've temporarily suspended that in-person meeting requirement of those rules as long as there's an opportunity for the public to participate in the meetings via video conference or phone call. I fully recognize this is not ideal. I fully recognize we need maximum transparency and public engagement, and this is a temporary emergency measure that, as soon as we're able to lift it, we'll go back to normal.
Hi, thank you. Yes, we received yesterday a letter from Common Cause and the ACLU asking for some additional measures to help public boards and bodies comply with the governor's executive order, and we appreciate that feedback. We appreciate Common Cause's help, actually, in helping craft the executive order at the outset, and so we will be working with them to incorporate those changes. These are largely implementation goals, things like making sure that if the video system breaks down, that we pause the meeting, that there's an opportunity to put the recording online online so it can be viewed afterwards. We take seriously and want very much to make sure that public participation, public transparency, and public access to public meetings remains in this difficult time. And so we'll continue to work with the ACLU and Common Cause to incorporate that valuable feedback to make this a better process as we move forward. And we appreciate everyone's patience so that the public can still be engaged in the process, but that important work of government and public boards can continue at this unique time.
Governor, another question about the kids. This reporter writes in, what provisions are being made for children in DCYF care as far as support and supplies, most likely for school and for living?
Yes, thank you for the question. DCYF social workers are in touch with families. However, I do want to draw everyone's attention to Family Service RI. We have been raising philanthropic funds to funnel to Family Service RI, and they are providing wellness packages and disinfectant wipes and such to families who otherwise couldn't be able to afford these sorts of things. So if you're having trouble getting them, Family Service Rhode Island, or call 211. We're also raising philanthropy into the United Way, and they have resources now specifically for this need.
The next question is, what type of facilities would you look at if a quarantine needs to be imposed?
So the way we're approaching that is we have taken an inventory of essentially all the buildings in Rhode Island. We are looking at college dormitories, hotels, vacant buildings, former hospitals, the convention center, really any building that might be suitable. We are digging into it. And that's exactly why I asked for the Army Corps to come help us, because we're at a point now where we've identified a number of sites, but then the question becomes, how quickly could they get up and running? What are the engineering challenges, et cetera?
And continue with that thought, are the dorms at Rhode Island College already being utilized for people who have been quarantined?
No, we have not done that yet. At this point in time, our approach to quarantine is mainly the honor system. We're asking people to stay home, with a very important note that every single person in quarantine is in touch with someone at the Department of Health. So the Department of Health is aided by the National Guard and aided by a staff. We're calling people. Hi, have you stayed in your house? Do you need a hand getting groceries? At some point, and I hope at some point relatively soon, we're going to have a system where we can do a lot more testing, easier contact tracing, and then we might actually force people to go into quarantine. In fact, we will force people to go into quarantine into a specific building, or maybe we'll ask them to stay in their house under much closer supervision. But right now, we're not there yet.
I think I can speak for many people when we were thrilled to see that Rhode Island was ranked first on Wallet Hub's analysis ranking when it comes to the aggressive response. Any thoughts on this?
Being aggressive is the name of the game in this one. So every day matters. My approach is to take action. Take action, because, and I would like to say, not every decision is going to be perfect. I may have to revisit decisions. But if you wait too long, you've wasted a day or two, you're climbing up that hill, and you've lost valuable time. So I think Rhode Islanders should feel good about that. If you're sitting at home, like a lot of people are, reading the national news, reading social media, and getting more and more anxious, again, here in Rhode Island, we're being as aggressive as any place, and we've, by and large, been able to control the rate of spread.
There are reports that some people are traveling to Rhode Island from other states,
Yes.
Connecticut and New York, who have already shut down. Any thoughts on to monitor the borders?
Yes, tomorrow I will be making an announcement as it relates to domestic travel from other states to Rhode Island. So there, a lot of folks in Florida, a lot of folks in New York, even folks in Boston, and we are working through the details of that. As you can imagine, it's complicated, and we want to get it as right as possible. So tomorrow at the 1 o'clock press conference, I will be making an announcement around domestic travel back to Rhode Island.
And what about the people who do live out of state but work here? Will
Yes,
they still
so
be allowed
that
to come
is,
to work?
sorry, that's one of the reasons that this is complicated. It's a fairly easy decision to say, if you're, flying home from Florida or taking a train back from New York, to mandate people to be quarantined for 14 days. In fact, you should be doing that. The harder question is what Margie just asked around daily commuters. And so every decision I'm trying to make is based on data, facts, and evidence. So we're going to take the rest of today to continue to gather a little data and come out tomorrow with the best order that I can craft in order to keep Rhode Islanders safe, recognizing that anything we do will be temporary and is intended to now, in this most critical period, make sure we do everything that we can to stop the growth of the virus.
And our last question today, what kind of direction are you giving child care centers and daycare centers about opening when their parents have to go back to work this week?
Yes. Okay. So I'll say this. Most parents should not be going to work this week. You should be working from home. I recognize that's not practical. Doctors, nurses, us, there's many people for whom that doesn't count. And so we are working furiously to roll out a system of effective, safe, affordable child care for essential workers. As you can imagine, that is complicated. And I don't like what I'm seeing in some other places where they're opening large gymnasiums and recreational centers and having out-of-work school teachers watch kids. The whole point here is to keep people in small groups. So tomorrow, if this is an issue for you tomorrow, the Boys and Girls Club and YMCA have been in constant contact with the Department of Health and DHS. They've been phenomenal partners, and they have safe child care facilities. YMCA, Boys and Girls Club. Tomorrow or Tuesday, I will be making a broader announcement about child care and babysitting for essential employees, which will be as safe and effective and affordable as we know how to do under the circumstances. And again, I'm sorry, I have great sympathy. As a working mom myself, I know it's tough. So Boys and Girls Club, YMCA tomorrow, give me another day and we'll have a better solution Monday or Tuesday. And thank you for your patience.
That was it.
Okay, thank you everybody. Hang in there and we'll see you tomorrow.
You've been listening to Governor Gina Raimondo give her daily update on coronavirus here in Rhode Island. A couple of key highlights today. Governor Raimondo pleaded with people to stay indoors at home, saying she may have to consider a statewide lockdown in the future if people do not listen to the directions, especially this week when it's crucial for containment. She announced there are 17 new cases today, bringing the total in Rhode Island now to 83 cases, and the governor will be signing an executive order, she said, to shut down all hair and nail salons, movie theaters, and recreational facilities. That will go into effect at 5 o'clock tomorrow afternoon. But she said tomorrow is not a day to still go to work at those places. It's really just for owners to wrap up everything they need to temporarily close for the time being. And one other big takeaway, distance learning begins tomorrow for students and teachers across the state. It will look different for every district, but will be heavily focused on online learning. The governor is expected to make more announcements and potentially more executive orders tomorrow concerning domestic travel and also child care and extreme measures for people who still really do need to go into the office or hospital setting to go to work during this time. So stay with Eyewitness News right now on WPRI.com and the WPRI News app. We have minute-by-minute updates on new restrictions and cancellations. Thanks for joining us, and be sure to join us for Eyewitness News beginning live at 6:30 tonight here on WPRI 12.
Stay with Eyewitness News for the latest on this breaking story.